Thank you.
Yeah. Okay. Thank you, Megan, for organising this, and Russell. So today's speaker is Mike O'Driscoll, who is a research fellow with our Centre for Critical Research into Nursing and Midwifery. I've known Mike for 20 years, and we've worked together on various projects to do with nursing education mostly, but latterly more related to your thesis, Mike, around the provision of services. So I'm delighted to be here to introduce you and to listen to your presentation on your PhD. So well done, and look forward to listening to what you have to say.
Right. Now, thanks very much, Helen, and thanks to everybody who's managed to find the time to take part. So, yeah, I mean, I will be talking about some initial findings from my PhD research, which was looking into the attitudes of the public and other stakeholder groups, you know, particularly NHS staff, NHS health professionals, and people who are, you know, actively working for change to NHS policy. So there's 3 or 4 main stakeholder groups, and today I'm looking at the first bit of my research, the first data collection I've done, which was a survey of the general public about attitudes to privatisation and rationing in the NHS. So I will aim to finish at about 1:45 to allow time for questions. So that's just a outline of what presentation will in the presentation. And I'll start off by just giving a brief background of, you know, the history of the privatisation in the NHS. You know, first of all, in time-honoured academic fashion, what do we mean by privatisation? Well, here's some, you know, reasonably good definitions at a general level. You know, just the increasing involvement of non-governmental bodies or actors in the provision of healthcare services. Is the top definition from El Gingi, who's written quite a lot on this subject. I am also going to be touching on issues of, you know, rationing of healthcare, and at the bottom there's a brief definition there of what that means. The focus of this research is more on privatisation than rationing, but the two often tend to be associated. So rationing is basically about, you know, a clinical commissioning group, a local healthcare commissioner, that is, you know, might decide that they're not going to provide a particular service, such as, you know, fertility treatment or varicose veins, or just might restrict the access very heavily. So that's what rationing refers to. So thinking about what examples of what privatisation could include, it could be, you know, private healthcare companies providing healthcare services which are paid for by the NHS. You know, for instance, having a procedure done, you know, funded by the NHS but carried out in a private hospital, or equally NHS providers, you know, trusts or hospitals treating private patients, and there's a lot of that occurring and has increased a lot over recent years. Trusts are, in fact, now, since the Health and Social Care Act 2012, are allowed to get up to 49% of their income from private work. So a lot of an NHS hospital might be full of have quite a lot of private patients at any given time. So other forms of privatisation could include, you know, selling off NHS assets. Again, there has been an awful lot of that recently. Financing the building of NHS infrastructure through, you know, private sector loans, and the infamous private finance initiative, which has been compared to, you know, getting a mortgage on your credit card, because the interest rates are, you know, very high, and many trusts are still, you know, crippled with debt from PFI initiatives that, you know, go back decades. So that's a form of privatisation that perhaps is not talked about so much. You know, we tend to think about private healthcare companies coming in and providing services, but yeah, there are many other aspects. So you could also think about, quite topically, about, you know, the outsourcing of services, which could have been provided by the NHS. So, you know, obviously one massive example recently was the decision to let a private company, Serco, do the test and trace around COVID, which I don't think has gone too well, it would be safe to say. And the cost of that so far, 22 billion, and many people have, you know, pointed out that it could have possibly been done more efficiently by using the, public health expertise in local authorities, who've already got test and trace around other viruses such as HIV. Yeah, there's a few other examples there of types of privatization. I'll skip down to the last one, which again is an increasingly an increasing phenomenon of the NHS sharing or selling patient data to large corporations, like Amazon and Google, and that is privatization in that it's being used for partly for private purposes. There hasn't been a lot of public discussion about how that works, or what the NHS will get in return for this, or even whether we want to be part of it. So just to emphasize that privatization is involves a lot more than just private companies doing some NHS work. And I'll briefly look at the what's the background to privatization in the NHS? Where did it come from? Did somebody wake up one morning and just decide that we'll have some privatization in the NHS? Really, it comes from what's called the New Public Management movement, which was started in the US in the 1980s. Very popular with Ronald Reagan, and through him, to Margaret Thatcher. And this movement was kind of, applied to many public services in the UK, and the NHS was one of the first. It was like the guinea pig for new public management, and it was one of the most deeply affected services. And here I've put some of the bullet points about what new public management involves, but essentially it's imposing private sector models or norms onto public sector organizations in the belief or the claim that there is much to be gained in terms of efficiency, cost saving, and becoming more dynamic, but there is precious little evidence of any of those benefits actually being realized. So arguably it is more of an ideology than anything else. But this is the context to privatization in the NHS. This is what really kicked it off, the idea that if we just bring in sort of private sector expertise and norms, everything will get massively better. So some of the the major milestones of privatization in the NHS, 1983. Griffiths, I think, was the chief executive of Sainsbury's at the time, and so again, quite a naive idea to my mind that if somebody is doing well in the private sector, they understand private sector business, then automatically they're qualified somehow to improve the NHS. And I think again recently the chief executive of Sainsbury's was again invited to advise the NHS just in the last few months. Not the same guy, obviously, but it's these things go around in circles. Again, it's the same idea that the private sector must automatically know better. The internal market was a huge milestone in privatization, and the internal market is basically splitting the NHS into those that commission the services and those that provide them. The providers being the trusts. And again, the idea was that if you have choice, competition, payment by results, imposing a kind of market model, that this will lead to improvements in cost savings or better care. But again, there is very little evidence that that's the case. During the Blair years, there was quite an expansion of the private sector, although there was some, ideologically they were not particularly backing the idea of the internal market. In fact, they spoke out against it, but in reality there were quite a lot of expansion of the private sector, allegedly to sort of clear backlogs and waiting lists, but it actually went quite a way beyond that. Foundation trusts were established in the Blair era as well. And the idea of foundation trust is basically that the trust gets more and more autonomy. They control their own budget, they can raise their own revenue. So to all intents and purposes, they become like a semi-autonomous business unit. They are, they're designed to look like businesses and to work like businesses. Although, of course, ultimately a business can go bankrupt, and trusts, whenever trusts get into serious financial trouble, the government will step in, because ultimately they can't allow parts of the NHS to become bankrupt, because the political fallout, apart from anything else, would be enormous. So it's kind of trying to impose or mimic a market model, but it's kind of a game in a way that it's not really a market, because it's actually not possible to create that within the NHS without some very serious consequences, which the government don't want to have. PFI I've already touched on. That's private sector finance for largely for building hospitals and or extending hospitals. Choose and book was again about patient choice. You can go to your GP and choose where you want your operation or procedure to be carried out. Again, it does beg the question, well, if people are choosing particular hospitals, what happens to the other hospitals that they don't want to go to? Shouldn't we just be trying to improve those hospitals rather than helping people to choose the most popular ones? In practice, what tended to happen was that people just chose their local hospital anyway, because they were more interested in convenience than examining tables of performance data. So it's perhaps a slight illusion that you can choose your hospital in the same way that you could choose your bank or your insurer or something like that, or your supermarket, because healthcare doesn't really work like that. Perhaps the biggest milestone in privatisation of the NHS to date, and which I'm focusing on quite a lot in my research, is the Health and Social Care Act of 2012. The Health and Social Care Act, which I'll come to the details of it later, but basically it expanded privatisation in many ways, and to a great extent. I'll come on to the details of that. But just to look at which areas of the NHS are currently privatised, what do we even mean by that? Well, as many people probably aware, GPs, dentists, pharmacists, etc., are private businesses, but in the case of GPs, they tend to have just one client, which is the NHS. But technically they are private businesses, so they are part of privatisation. Many community-based services are now delivered by private companies. Particular sections of hospital inpatient services are privatised, such as those around mental health, disability, and as I've said there, extract from The Guardian, locked ward rehabilitation for psychiatric inpatients is almost entirely provided by the private sector now. And social care, although not part of the NHS, but obviously very closely linked, and that has largely moved into the private sector, away from local authorities. So can we put a number on the amount of privatisation? What percentage of the NHS is privatised? Well, a figure you'll often hear in the media is 7%. And that's basically if you accept the government's own figures and repeat them uncritically, which the media tend to do. So 7% would be based on what percentage of CCG's expenditure basically goes to private healthcare providers, and that would give you 7%, which sounds small and not much to worry about. But that figure does exclude expenditure by the Department of Health to local authorities, and it deliberately excludes or sort of conflates expenditure which goes to organisations which are technically not for profit, but which we might consider as private sector. So Bupa, for example, I believe is a not for profit, but it's still private, it's privately owned. So it should technically count, if it's providing a service to the NHS, that should count as part of NHS privatisation, but it doesn't. That's not included in the official figure of 7%. So this research, which I've quoted there from Rowland, shows it would actually be 18% of the NHS expenditure that's going to the private sector if we included that expenditure to local authorities and to sort of hidden private sector. And if we also include primary care, we could get somewhere like 22 or 26%. And that would still not be adding in things like the PFI, etc. And there's been a massive expansion of private sector since COVID, of course, through test and trace, and the vaccination is going to be involve the private sector a lot also. Yes, I've misspelt private sector there, privat sector. I'm not sure what that is. But anyway, the key point being that really we're talking about a quarter of the NHS expenditure being going into the private sector rather than the much quoted 7%. So briefly, we could ask why does it even matter? Why does it matter how much the NHS is privatised? Well, I would say one of the biggest reasons is that there's no evidence that it actually increases efficiency or standards of care, and large literature reviews have been done about that, and there really is no meaningful evidence that privatisation improves healthcare. There is, however, a lot of evidence that privatisation leads to increased costs. So the Health and Social Care Act, for instance, forced a lot of external tendering of healthcare contracts. So the NHS has to tender out a lot of healthcare contracts, and you can imagine the army of lawyers, management consultants, people to monitor the performance on the contracts, lawyers to deal with contract disputes. It's a huge undertaking, and it's estimated that that process alone costs 4 billion a year. It's not a surprising figure. Another reason why you might worry about privatisation is because of there are question marks around the performance of the private sector hospitals, for example, particularly on safety. Lack of transparency in reporting safety issues. Privatisation tends to lead to fragmentation, instability, because rather than a sort of joined up approach across the health service, you've got people in each small locale, each area controlled by a clinical commissioning group, negotiating their own contracts. The contractor may go bust. Contractor may decide the contract isn't profitable and walk away at the end or even during the contract. Then the NHS has to pick up the pieces and provide a service there in very short time, not having had the experience of running that service for the last few years while it was being done privately. So it creates a lot of instability and fragmentation. Other things you might object to are that for instance, private providers don't contribute to the cost of training nurses, for example, and yet they're using nurses who've been trained within the NHS. So that may give them an unfair advantage because they don't have to cost that into their own cost base. Private providers might be unwilling to share learning with other services. Apologies for the typos there. They may consider it's commercially confidential because it's their competitive advantage. If they find out how to do something in a better way, they haven't necessarily got an incentive to share that information. Some people might say there's a fundamental incompatibility between making decisions about people's healthcare and the profit motive, and that those two things should just be divorced. And finally, you might say a democratic deficit. It's quite hard to hold a private healthcare company accountable if you're unhappy with the care received, and that there's no sort of democratic way of controlling that really, or inputting to how it's done. So just mentioned the Health and Social Care Act before as one of the main vehicles for moving privatisation forward within the NHS. So the Health and Social Care Act was started to be introduced around 2011, actually came into effect around 2013, I think, and it became law in 2012. So it was interesting, the context around that act was brought in by the Conservative and Lib Dem coalition that came to power in 2010. And the Conservative Party slogan at that election was, the NHS is safe in our hands, and particularly ironic, I would say, no more top-down reforms, which they promised, and then did, the biggest reform in NHS history, which was not in the manifesto of either party. So, there's a democratic deficit there, definitely, because nobody voted for that, literally. It's not clear what the objective of this reorganisation was. In 2010, the NHS was in quite good shape, by most global indicators compared to most health services in the world. It was doing extremely well. It had followed a period of getting increased funding under Blair and Brown, and although obviously there are always things that could be better and things that you need more of, I think most people probably agree that it was a good period for the NHS, and it was doing quite well. So why did we need a massive reform of the NHS at that point? It's not at all clear, and no real rationale was in fact ever given. So there are suspicions that it was basically ideological and a wish to increase private sector involvement more in the NHS. So how did it do that? Well, one of the biggest things was that foundation trusts were allowed to get up to 49% of their income, almost half their income, from private patients. Another huge thing about the Health and Social Care Act was, for the first time, having an external market. So we had an internal market since the 1990s, but from the Health and Social Care Act onwards, the NHS was obliged to put contracts out to any qualified provider. So that's, they could be private, they could be NHS, they could be third sector. But the presumption no longer could be that it would be an NHS provider. It could be anybody. It could be Virgin Healthcare. Anybody who wants to put in a bid, basically within reason. And this bidding process contracting process was overseen by a newly established body called Monitor, which is somewhat equivalent to Ofcom or Ofgen, copying these markets of these models rather for the privatization of public utilities. Another big thing that happened in the Act was that primary care trusts were abolished. So those are the bodies that previously coordinating healthcare commissioning for reasonable sized areas, and instead clinical commissioning groups were formed, which is groups of GPs. CCGs tend to be much more smaller and local than PCTs, so that's part of what I was referring to as fragmentation, because very, very small local areas are doing their own doing commissioning, so that makes it difficult to have a joined up approach across larger areas, and so less less benefits of reducing costs through scale, and less sharing of information, less integration overall. This Act also abolished the duty of the Secretary of State to provide a universal healthcare service, which is quite amazing, really, if you think about it. There was no longer a requirement on the government to provide NHS services to every member of the population. Instead, the government would assure a basic minimum, but it was more or less up to CCGs in each area then to decide exactly which services they wanted to provide, and to who. CCGs do not have to accept everybody who lives in their local area. They can pick and choose to some extent. So it seriously undermined the idea of a universal healthcare service, basically. And public health was sort of farmed out to local government, which most people, well, a lot of people would probably say is not a bad thing, but at the time, local government was being sort of rather savagely cut back financially. So sort of jumping forward in time, in 3 or 4 years, the Health and Social Care Act came into effect about 2013. So in fact, we're not jumping forward that many years. By 2014, the government itself was admitting that it had been an enormous mistake, and that's on the record. So, within a couple of years, or even within 1 year of the Act becoming law, it became clear that all of this increased administration, the fragmentation, very complex networks of providers, was having very detrimental effects on the NHS. And particularly, it was obstructing the government's own stated agenda at that time, which was to integrate more, and particularly to integrate health and social care. So it's a bit difficult to do that when you've just kind of smashed the NHS into, you know, dozens of small pieces, and everybody's kind of doing their own thing to a certain extent. So the new plan, if you like, was to think about how to have more integration. So this didn't necessarily mean ending privatization, but it did mean that the government was thinking more about not having competition. So still allowing the private sector to be involved or even to lead, but not to force the tendering of each contract. So retaining privatization, but with less competition. So the model the government, were thinking about using in 2015, and which has come to pass to some extent, is based on a US model of what are called accountable care systems or accountable care organizations, which is basically networks of commissioners and providers in an area who come together. They're given a budget, and basically their job is to work together to try and healthcare, essentially, to try and keep people out of hospital, very specifically, to reduce the number of people coming to hospital, because that's one of the most expensive parts of the system. And if they, to the extent that they can do that, they get to keep part of the budget that they've been given, to reinvest in their local healthcare. So basically, they're heavily incentivized to ration healthcare, and that's the model that the government have already brought in to the NHS, and that can involve private, public, and third sector organisations. So again, that's a lot of private sector involvement, increasing private sector involvement, but doing away with competition, which was said to be one of the main benefits of involving the private sector. So the accountable care organisations, as they're called in the US, were rebranded in the UK because it was attracting too much bad publicity. So they started calling them integrated care organisations or integrated care systems, but it is exactly the same model. In 2018, when they were still calling them accountable care organisations, Health and Commons Select Committee compiled a report on this, and this extract, I think, paints a picture of what may be down the road. A short time from now, maybe maybe not, because accountable care organisations could be private or public led. In what you might call a worst case scenario, you could have a large private healthcare company running the entire health and social care budget for an area on a 10 or 15-year contract. So the Health and Commons Select Committee were keen that if accountable care organisations happen, that they should be public bodies, and that there should be legislation defining what they are, how they work, and how they're controlled, and how people can make them accountable. But that hasn't been done. So if an accountable care organisation could at the moment be a private, public, or third sector body. So it remains to be seen how that will pan out. So what do we already know about public attitude to privatisation? All of this stuff is going on. What do the public actually know about it? How do they feel about it? Well, some of the existing research has been done. There's quite a lot of opinion polls that show that the public basically, are not very sympathetic to privatisation, and even amongst Conservative voters, a large majority don't want the NHS run by the private sector or in the private sector. And of course, there's a lot of ambiguity there, which I've tried to explore in my research about, what do we mean by privatisation? Because it can take many different forms, as we've seen. So if you just ask people in an opinion poll, are you for or against privatisation in the NHS? It tells you a certain amount, but it doesn't tell you what sorts of privatisation they might be happy or unhappy about. So there are big gaps in the literature there about deeper examination of what we mean by privatisation. The research that's been done is basically opinion polls with the general public, and there's very little qualitative research or research with people other than the general public, such as NHS staff. So, there's a big gaps there in the literature, which, I hope I can make some move towards filling. So my research questions for my PhD, all three of them are here. One highlighted in red basically is what I'm going to be looking at today. So what are the patterned what are the patterned understandings of the Health and Social Care Act and privatisation and rationing amongst the general public? So the other groups I have yet to do my data collection with. This is a brief look at what my research design looked like originally. The survey that I'm going to be telling you about today, here, the online survey of the general public, was supposed to come further down the line, but I had to seriously reorganize my research because of COVID, made it basically impossible to do research in trust, which I had originally planned to do, and it all had to go online. And so for various reasons, I've had to do the survey first. I'd rather it had been informed by qualitative research and then do the survey, but this is how it's panned out just for pragmatic reasons. So the online survey that I did is just adults in England. I'm not looking at the NHS, perceptions of the NHS in other parts of the UK, because they do have very different approaches. Like Scotland has more or less booted the private sector out. So there's an interesting research there to compare and contrast, but that's not what I'm doing. I'm just looking at attitudes in England, basically. So I did a survey, and it was more trying to match it to the population of England on some key demographic variables, and I got 200 odd responses, which I've only very recently had time to start analysing. So these are some of the areas that are covered in the questionnaire. It's quite wide-ranging, so there's a lot of analysis that I can do, but I won't be able to go through all of this today. But hopefully I will look at some of the key questions and break them down by demographics. This is some of the characteristics of the sample. I did try and weight it towards to make sure we got a good proportion of people on lower incomes who use the NHS more. It's a reasonably balanced age response. And the demographics captured were quite extensive, so covering things like disabilities, care, whether they're a carer or not, relationship status, political affiliation, and how people voted in the EU referendum, and whether they're NHS staff or not. So having a look at my survey findings, just a headline result there. I asked people, to what extent did they think the NHS had already been privatised, and 71% felt, to some extent or a great deal. 60% agree that there should be less privatisation in the NHS. So people think there's been a lot of privatisation, but they want less privatisation. Looking at this question was intended to assess awareness of some of the major changes in the NHS that have happened recently, such as the Health and Social Care Act. Okay, not that recently, actually, 2012, but also, more recently than that, the accountable care systems, which I mentioned. I was wanting to see how aware are people of these recent bits of legislation, and some of the new bodies that were founded as a result of that legislation. So the mean awareness score, the maximum was 4. So we can see that we've got 2.91 out of 4, even for NHS England. So when we get down to things like the Health and Social Care Act, it's clear that most people have not heard of it, and even less so for accountable care systems or accountable care organisations. So this doesn't surprise me much. I didn't think people would be particularly aware of these things, but it does underline an important point that these massive changes can be made to the NHS, and further impending huge changes which will probably increase privatisation, which people say they are against, and yet people are hardly aware of them. Very few people are aware of them, and even those that are aware don't know very much about them. I did break down awareness of these various bits of legislation and changes by demographic characteristics to see, what's the pattern of awareness? Are there big differences? Do different demographic groups have different levels of awareness of these changes? So I won't go through all of them, but just for instance, the Health and Social Care Act, the data analysis method I used here was, if anybody's interested, was ANOVA, as used in SPSS custom tables. It's just a very quick way of seeing patterns in the data and looking for statistically significant patterns for a large data set, doing it in a quick exploratory way. So what this tells us is the Health and Social Care Act, 18 to 24-year-olds had higher awareness levels to a statistically significant extent than groups D, E, and F. So that's the older people, 50 to 64, 65, 75, 75 plus. So basically, to quickly summarize this, younger people are more aware than older people on most of these changes to a statistically significant extent, which is possibly interesting given that younger people are less likely to use the NHS. So I don't have time to go through all of the demographic breakdowns on awareness, so by gender, by income, whatever. So I'm just summarizing here some key bullet points that generally speaking, men were more likely to be aware of some of these changes. Higher income groups were generally more aware. Some regions of England were more aware than others. Married people were more aware than single people, and single people were more aware than widowed. If you had children under 18 living in a household, you're more likely to be aware. Political affiliation, there were no differences, which was interesting. I suppose one might have thought that perhaps people, Labour supporters or Lib Dem Green supporters might be more aware of these changes, but not really. Remain voters tended to have slightly higher awareness, but not to a statistically significant extent. I did also ask about media sources used for information about the NHS, because I thought this is probably a key factor in how aware people are. And those who use social media blogs and who watch Channel 5 have the highest level of awareness of legislation reform and recent reform in the NHS. So perceptions about change in the NHS. If 5 means increased a lot, 1 means decreased a lot. So you can see that overall, most people thought that the cost of running NHS has increased, waiting times have gone up, privatization has gone up, and the number of nurses, doctors, beds, and dentists has gone down. Number of staff vacancies has gone up. So I think those are pretty good reflections of reality to my mind in terms of what has actually happened in the last 10 years. Just doing a demographic breakdown on one of these, which is the amount of privatization, looking at awareness of changes in the last 10 years by political affiliation, we can see it's actually not much difference. So whether you're Labour, Conservative, Lib Dem, Green, there's not a great deal of difference in your perceptions of how much change there has been in the NHS over the last 10 years. Although on the range of treatments or operations available, Labour supporters think these have increased more than do Conservative supporters, for instance. And Conservative supporters are more likely to say the number of hospital beds has decreased slightly compared to Labour. So those are quite small things. I think overall the picture I would say is that there isn't much difference on political affiliation. Doesn't make that much difference to how much change you think there's been in the NHS. Those who are most likely to say there's been an increase in privatisation live in the northwest of England, more likely to use Channel 4 or Channel 5 as their main source of info about the NHS, and no other significant variation. So again, that's interesting in itself. I think that's just that across the board, people are aware that there's been an increase in privatisation. Perceptions about change in the NHS over the last 10 years, regarding sort of what you might call rationing, views on the change in the range of treatments or operations available. A slight effect there of Labour and Conservative being less likely to say there's rationing than Greens. And those sorts of information the BBC on the NHS is the BBC are more likely to think that there hasn't been rationing. So I'll just skip through that if I may, because I haven't got loads of time. So again, I'm just looking at demographic changes in relation to perceptions of change, and this is on the number of nurses. So some groups are more likely to think that nurses have increased than others. What actually means, it remains to be seen. I have to explore the data more thoroughly and see if there are any deeper underlying patterns. Views on change in the cost of running the NHS. Older people are more likely to think that costs have increased. And those who rely on the BBC most are more likely to think the costs have increased, but no significant variation otherwise. So just a sort of overall summary on that. A large majority of people think the NHS has already been privatised to some extent. Awareness of increases in privatisation seems to be fairly evenly spread across all demographic segments. Limited awareness of rationing of NHS services. And those who use Channel 4, Channel 5 news and blogs are more aware of changing the NHS and perhaps have a more critical attitude. Why does privatisation matter? Well, why does it matter how it varies according to demographic group? Why does it matter how aware one group is compared to another? Well, I would say maybe useful, in trying to raise awareness about privatisation in the NHS. If we know which groups are least informed, then that gives you a target to aim for. It may also tell us something about how awareness is shaped. Do those groups who are less aware consume different sorts of media, or is it just they have different sorts of lifestyles? So it can give some insight into how people come to understand the NHS more generally, and privatisation in particular. And there is very little evidence about this in the literature about how awareness of the NHS varies by demographic groups, so it's filling a gap. I'll just give a very short look at this. I mean, this is about actual public spending on the NHS, and most people thought that spending on the NHS had increased since 2010. In percentage terms, it hasn't increased very much. In fact, as a percentage of our national spending, it's gone down. But yeah, I think there was a lot of talk before COVID about the NHS is becoming unaffordable and sort of spending's out of control, aging population, blah blah. In fact, we're spending sort of less on it in real terms than we were a few years ago, and compared to most European countries, actually less. So I think it can be interesting to ask the perceptions against what you might call reality, although there's a lot of things that could be debated there about how you measure spending. I'll quickly whiz through what people have considered to be the biggest problems facing the NHS. In relation to my thesis, about privatisation, what I should draw attention to is that people don't consider privatisation one of the biggest problems or challenges. So only 4.5% of people chose that as their biggest single challenge for the NHS. Underfunding was the biggest one, which ties in to what last slide, and obviously dealing with COVID. So privatisation isn't considered a big priority by most people in terms of what the NHS should, the problems or challenges for the NHS. Equally, we must look at sort of solutions in inverted commas to problems with the NHS. Less privatisation. It's up there because the scale here is 1 to 5, and this has got a mean of 3.86. There should be less privatisation in the NHS. So a lot of people agree there should be less privatisation, but it's not. Again, it's not seen as the most important solution, because privatisation is not seen as the most important problem. Yeah, briefly, why does NHS privatisation keep increasing, given that most people say they're against it? Well, as we've seen, lack of knowledge, lack of awareness, and I would say, one part of my work will be to analyse some online media, coverage of privatisation in the NHS. But just anecdotally, I haven't done that analysis yet. Anecdotally, I would say media coverage doesn't talk about NHS privatisation very much, and even NHS documentaries and dramas, of which there are a lot at the moment. It's rarely touched on. There are a lot of lobbying groups who are lobbying for privatisation, and they have quite close links to government. And I did also ask people about how much they think they can influence the NHS. I haven't analysed that data yet, but I think there's going to be issues around people feeling powerless, not knowing what to do. So they might not like the privatisation, but they don't necessarily know how they can affect it. So sorry, I've just seen your message about ACOs, Helen. I'll come back to that if that's okay. So, oops. Okay, so yeah, and just one other thing about why privatisation might keep happening, even though people say they're opposed to it. Well, as we've seen in the 2010 election, political parties do not necessarily declare on their manifestos what they're going to do. People don't just vote on their NHS, preference, although they often do, they do say that it's when asked that it was the most important thing in deciding their vote. But it's also clear for 2019 that most people were voting in terms of their desired Brexit outcome rather than their desired NHS outcome. So those some of the we have a first past the post system. So even though the majority of the population might be opposed to NHS privatisation, if you get 43% of the vote, you get all the power under large majority. So it's kind of arguably an aspect of our first past the post system that helps privatisation to keep increasing. So I will end there and take any questions.
Thank you, Mike. That was really interesting. I'm sure there are questions. One of my questions was about the ACOs, but we'll leave that till a bit later, and I don't mind us having a coffee and discussing that at a future date.
Okay. No, I'm happy to talk about that.
And I would also say, just one bit of context, I was a patient representative on our local integrated care group, and I would say the lack of public awareness locally, I live in West Sussex, is remarkable, I think, about the changes in the NHS. And I think the COVID pandemic has unmasked a lot of this for people in the members of the general public. Anyway, less from me, over to other people. So any questions for Mike?
I'm just having a look. I see there's a question from Zari. Do people believe pandemics has been do people believe a pandemic has been used to cover up and to divert public attention and as an excuse to expedite NHS privatisation?
Yeah, well, a very interesting question. So, yeah, I mean, I think the answer, I would say is yes to a large extent. I think it's not necessarily a sort of sinister plan necessarily. Even I think it's just that the current government's reaction to nearly every problem is the private sector in crude terms. So in relation to test and trace, which I touched on, many people have observed that could have been done much more effectively, using local authority expertise, because local authorities do have test and trace expertise for testing and tracing on things like HIV and other notifiable diseases. So they, rather than give 22 billion plus to a company that had no prior experience in test and trace, which is Serco, and a long track record of failures, I'm afraid to say, they could have invested in local government and given them more resources. 22 billion, I think, would have gone a long way in local authority hands. And so, yeah, I think it's COVID-19 is exposing the government's kind of knee-jerk reactions to privatise it, to use the private sector, rather than explore, what might have been possible using public sector expertise. So does that answer your question?
Yes, thank you. I think that's what I wanted to raise, that, you know, instead of giving the budget to NHS and there are facilities there to be used,
Yes.
the money is given to private companies, and they might not make the most use of the budget. You know?
No, I think that's right. And I mean, you know, I suppose you could say privatized, it's not even about privatization in itself. It's kind of it is partly about that, but it's also like the really haphazard way it's been done. You know, not having a proper tendering process, you know, and a lot of it looks like cronyism, I'm afraid. So, you know, you might say, well, you could have privatization and do a proper tendering process, and, you know, maybe you could find a firm that's got expertise in test and trace, and that might be, you know, that might have worked or worked better. So I think it's privatization plus a really kind of, you know, not following the proper procedures in procurement. And yeah, some very strange decisions around how PPE has been procured, many of which have, you know, have made the headlines, and particularly the test and trace, and also, you know, the app. Again, that was, you know, yeah, a bit of a failure. So yeah, I think it's a very good COVID, you know, a very sad case in, you know, how privatization doesn't work with the NHS. You know, I'm not saying that there are not examples where, you know, it could or does work. I think there are times when the NHS, you know, might need that extra capacity, and the private sector, you know, could help. But again, it's kind of a self-fulfilling prophecy, because if you keep relying on the private sector to give you that extra capacity, you never build the capacity in the NHS. And I think that's, you know, that's kind of what's happened. You know, the number of beds has been run down, the number of staff has been allowed to run down, you know, 100,000 vacancies. So the NHS was already kind of, you know, at capacity before COVID, and hence, you know, not entirely done. It's done you know, an amazing job, and everybody knows that, you know. But it was stretched, you know, to its limits and beyond already, sort of, you know, before COVID, I think. So you then have to almost rely on the private sector, because, you know, particularly in terms of beds, because, you know, there just isn't the capacity there. But of course, they found that, you know, you can buy hospital beds, but it's not so easy to magic up some staff if you've, you know. So they've got the Nightingale centres at great expense, but pretty much unable to use them because there's you know, they haven't got any nurses. And, you know, there was talk about at one time about, you know, getting vets and things to staff them. So yeah, the private sector solutions are not that simple. Yeah, you can get some private sector capacity just like that, but in terms of hospital beds, but you don't necessarily get the staff or the expertise to man them. So it's not a great solution necessarily.
Thank you. Yes, I think there was, before, when I was in clinic, there was always pressure of money to recruit bank nurses.
Yes, yes.
But there wasn't budget to recruit permanent nurses.
Yes, yeah, that's a massive issue, isn't it? And yeah, the NHS has its own sort of agency called NHS Professionals to, you know, to fill in sort of temporary staffing. And at one time, you know, they a couple of years ago, they even tried to privatise that, but they backed off from that in the end. But yeah, basically anything that is not nailed down is you know, potentially a target for privatisation. But again, you know, I'm not saying that, you know, private sector has no role at all, but you know, I think it's not been done in a very useful or thoughtful way that helps the NHS. You know, it's done very ad hoc, and there's a lot of assumptions always that, you know, the private sector, you know, must know best, which I think is astonishing, given, you know, we've got decades of evidence now that, you know, that really isn't the case. So yeah, I think COVID has been really brought it into the public view, you know, about, you know, how dysfunctional privatisation can be, and, you know, I suppose one might hope, therefore, that will make people more aware. Although I'm still not even sure about that, to be honest, because you know, talking to people about it here and there, I'm still not sure that it's really sinking in that, you know, that privatisation of test and trace, for example, could have been done in the public sector, could have been done by local authorities and the NHS working together. So maybe again, it still comes back to media coverage, partly about how are they portraying these things when they don't work. What are they saying is the reason? Because I noted on a lot of media coverage about test and trace, they didn't use the word privatisation. When they kept saying the government's made a decision to centralise the service. I thought that's very strange wording, but that was often what was said on the BBC and other places. And so I was kind of shouting at the radio, no, it's not centralisation, it's privatisation. Centralisation doesn't mean a private company necessarily. You could centralise it and still keep it within the NHS. So there's kind of a lack of critical analysis in the media, I would say, very much. And sorry, yeah, I'm rattling on.
Thank you so much.
I think it's just fascinating, and I'm sure we could go on all afternoon. I think you've raised some really important issues for not only us as staff, as ex-staff members, current staff members, but students in the NHS. And thank you very much, Mike. I'm sure Mike will appreciate people emailing him with their comments afterwards, because it all richens the analysis. Thank you very much. And thank you everybody for attending. Thanks. Bye.
Cheers.